Good afternoon. Thank you, Governor. As the Governor said, we have 114 new cases of COVID-19 in Rhode Island. This brings our case count to 408. As the Governor has also said, we have, very sadly, one additional COVID-19 associated fatality in Rhode Island. That brings our number of fatalities to 4. This most recent fatality was a man in his 70s. Among the things we are looking at right now is whether any underlying medical conditions were factors in his passing. Our deepest sympathies and prayers are with this man and others' families. This person was not a nursing home resident, but there was a lot of news coverage about nursing homes over the weekend. So I do want to address that quickly right now. Nursing homes are places of concern because you have a lot of people living in one congregate setting, and because those people are more vulnerable to the complications of COVID-19, it makes it a top priority for us to address effectively. Like many other states in the country, Rhode Island has had cases in nursing homes. We have had approximately 15 cases in 3 different nursing homes. In response, we have been working very hard at the Rhode Island Department of Health, across state government, and in the community to make sure additional steps are being taken for this population and with these important facilities. For example, we are looking at the discharge process when someone goes from a hospital to a nursing home to prevent any transmission in the nursing home setting. We're also looking at environmental cleaning. It's critical for nursing homes and other healthcare facilities to clean regularly, ideally every 4 hours, really focusing on high-touch surfaces like doorknobs and railings. That means using EPA-registered hospital-grade disinfectants on those high-touch surfaces that exist and on shared resident care equipment. This is the same cleaning every 4 hours that should be happening in all healthcare facilities, as well as in all facilities where there's critical infrastructure and workers throughout the state. And of course, it is essential, it's critical that all healthcare workers stay home if they are sick and that they practice social distancing, which means keeping a 6-foot distance from others. Finally, we're excited about the expansion of testing through the additional sites that the Governor mentioned. Many people have been working very hard on this for quite some time. The process for getting tested is the same as it has been throughout this response for you as members of the public. If you think you need medical care, call your doctor. Do not show up. It's important to use the phone before arrival at any healthcare facility. If you don't have a healthcare provider, call an urgent care center near you. Community health centers near you are also an option so that everyone can receive the care they need, starting with a phone call. The healthcare provider you talk to will determine if testing is appropriate for you. If that is the case, you will be directed to a testing site. So the key is to call your provider to get the determination. We have been speaking regularly to healthcare providers. They now have the algorithm of patients. We have an expanded list of priority patients. So be patient and work with your healthcare provider to determine the testing approach. If you just show up, you are not going to be tested, as the Governor mentioned, and you are going to potentially expose yourself to other people who are symptomatic. As we have been saying, we want to expand testing so we can start pinpointing our response more. But please understand, whether you are positive by testing or whether you have not been tested and have symptoms, the actions you will be directed to take are going to be exactly the same. The treatment is the same. If you are sick, even if you think you just have a cold, you need to stay home. You need to stay away from other people. You can call your provider, and your provider will direct you to a testing site if it's appropriate. Over the course of this week, the number of people that fall into that criteria will expand, but we're taking that step by step. If your provider directs you to an appropriate site to get a specimen swab to be tested, then you can leave the home for that and then return directly home. We need everyone who has symptoms of illness to stay home and to stay away from other people. This even includes the people you live with. To the extent that you can, keep a distance from them within your home and use separate living spaces, such as a separate bathroom if that exists. Take turns if it does not, and do what you can. The people in your life as well need to be protected. Another key point is if you are sick with symptoms, the people you live with also need to stay home and self-quarantine, which means monitor themselves for symptoms, so that if symptoms were to develop in those folks, they are not out in public, out and about, and increasing the risk of transmission to others. We are at a very critical phase right now and need everyone to do their part to help us as a state manage this public health crisis. We're working closely with our healthcare facilities to make sure that the system needs to be where it should be. You're seeing what the numbers are. It's critical for you as members of the public to follow. We cannot have just 50% following the stay-at-home order. We need 100% of people to do that. And as you're doing it, think about your neighbors. Think about seniors who may not be able to leave. Think about people with disabilities who may not be able to leave. Think of your neighbors and call them, see how they can be helped. See how you can help set up a food delivery service for them and make sure that they have the essential services they need delivered to them as well.